Hi, this is your Rockland County Executive Ed Day, and we're here to provide with you the biweekly biweekly update on the coronavirus crisis here in Rockland County. I just got off the phone with I'm part of the control room at the state level right now. We were just on the phone with the other members of the Mid-Hudson region. We are one region, as you do know, as it relates to the issue surrounding coming out of the situation we're in and start phasing back into our economy. I want to give you an update. We are part of the Mid-Hudson region. Oh, by the way, get a pen and paper if you would. There's a couple of things we're going to be giving you at some point during the broadcast. The Mid-Hudson region, Rockland County is part of it. Currently, we meet 5 of the 7 criteria that are used to establish whether we can open our economy up or not. The 2 criteria we do not meet are the 14-day decline in hospital deaths based on a 3-day average and less than 2 new hospitalizations per 100,000 residents based on a 3-day average. Myself and the other county executives have had a very spirited discussion about the measurement of the metrics and the measurements of fatality as having something to do with where we're going right now. Now, look, every death is a tragedy. There's no question about it. But the fact of the matter is, deaths which mostly are right now happening in nursing homes really are not a true measure of the infection rate, because the person has been infected already and sometime later is passing away. So that issue has been a very hot topic on these phone conversations we've been having. We also continue to see new hospitalizations drop, and we expect that metric to be met soon. Again, that is a better measure of what is happening, because as we know, some people with COVID-19 show no symptoms or mild symptoms, and some show significant symptoms. So hospitalizations, I think, is a good metric to look at. But unfortunately, as I said, we're seeing deaths are still high. We have 594 have passed away so far in Rockland County. But again, the issue of this being a metric or not is still something that's being debated. I want to be perfectly clear. There's been a lot of conversation about May 15th, which is tomorrow, the 15th, Friday. It does not appear that we are going to be meeting that phase 1 criteria that's required for us to move forward there. So it looks like at the very best it'll probably be next week sometime. So we want to be very clear about that, because everybody heard the governor speak of May 15th. May 15th is the expiration of his emergency orders, and that is what he was referring to, and he has an extension on that to June 6th that he can activate at the appropriate time, should he wish to. I'm here again with John Lyon, my communications director. We call him the man behind the curtain, and he's been fielding your questions, and we can have at it, John.
Okay. So the first question comes in about New York State's antibody test. They developed their own test. This resident is asking when it will be available to the public here in Rockland.
Good enough. There are a number of private facilities that are offering antibody testing, but they are not affiliated with either the county or the state government. So you're best out reaching to your own doctor and asking who they recommend. New York State has been conducting random survey antibody testing, but no official site has yet been set up here.
And when that does change, we will, of course.
Of course, any information that we do get, we pass along immediately to our constituents, of course.
Okay. And we're still getting a lot of questions about what's going on in our nursing homes locally. Will residents be tested for COVID-19? Will staff there be tested for COVID-19? And also, who should we contact if somebody is in the nursing home visiting a relative through their window, because they're not allowed inside at this time, and they're not wearing a mask?
Okay, let's go top to bottom on this. It's a very very difficult situation. We had I think nearly 100 people who died here in nursing homes in Rockland County. That's of the 576 who passed. That's a significant percentage. I think it's around almost 25% across the entire state. And frankly, it's so bad right now, it is being investigated by the Attorney General. So there's a lot of pain here for families, and a lot of tragedy that we're looking at here, and it's being looked at. But to the point, on May 10th, the governor did sign an executive order 202.30, which mandated twice a week COVID-19 testing for all personnel in nursing homes and adult care facilities. we've delivered COVID-19 testing kits to nursing homes within Rockland County. The test kits were provided to the county by Rockland by the state of New York and were allocated based on the number of staff members to each facility. The Office of Fire and Emergency Services inventoried, sorted, and delivered these kits as directed by our County Commissioner of Health. Again, we got involved. We really had a difficult time. The state health department oversees these facilities. We do visit them from time to time, but we've bumped it up a bit because to do nothing at this juncture obviously wouldn't be human. So we are engaging a bit to try to stem the outbreak that seems to have gripped some of our nursing home and adult care facilities. And again, we don't have oversight, but we will do everything in our power to help our residents here in those nursing homes. We know how difficult this is and how worrying it is to the families. I've been on the phone with a number of them. We've gotten messages from them. They're unable to visit their loved ones, and it's a very, very difficult thing for them. I will just tell you, our Department of Health will continue to follow up as we can to ensure that each agency is aware of the proper protocol and to help them as we can and when we are able. I want to make a reminder to all, as per Executive Order 202.17, any individual who is over the age of 2 who is medically able to wear a face covering shall have a face covering over their nose and mouth with a mask or a cloth face covering when in a public place and unable to maintain or when not maintaining social distance. So if you are by yourself, nobody's around you, you're on a walking path, there's nobody walking around, you don't have to have a mask on. If you are anywhere where there are other people, it's a simple thing to do. Put the mask on, leave it on. There's no point to putting it up and down, because by doing that, if there's anything on the front of your mask, you're going to end up getting it on your face, which is exactly the last thing you want to do.
Okay. On to the next question. When do you see dental offices opening up?
Okay, dentistry is an essential business for emergency and urgent dental treatments only. Anybody who's had a toothache can certainly understand that. It hurts a lot. But you should contact your dentist if you are having an issue. That's the first thing you should do. It's likely the dental office will be included in phase 2 of the reopening as a professional service. However, the full details of the industries included in phase 2 has not yet been released. The latest info is on a new website. I don't think we've given this one out yet. There's a lot of information on exactly the process of phasing into our economy again. And I would urge you to take a moment to look through it, because a lot of the questions we get here, I'm sure are going to be found here, especially minute details about how our firms judge, what category are they in. That website is forward.ny.gov.
Up as we get a little closer to summer, is Orange and Rockland prepared for the high levels of energy usage that may be needed if people are staying at home more over the summer?
Because of people being home. They have offered some tips too, which I'll offer here to you, which they come in handy for saving some energy, which means we save some money. Quit your necessary programs if you're working at home. Use sleep settings on your computer. Turn the computer off and unplug it if you can when you're done working. Thermostats. I have this situation. I'm in an apartment house right now in Haverstraw, and being in an apartment is a little bit better temperature-wise than being in a single-family home, because you get less fluctuations in your temperature. I just turn my temperature off half the time, so I get to save some money on that. But check and make sure that you're not still doing the same kind of cycling on your thermostat when you were not around, and also check it because the weather's changing. So you may want to just take a look at the numbers on your thermostat, the times it's going off and on. Use as many of those cycles as you can. If you have a bigger thermostat, you can. Plugs into power strips. Plug your phones and computers into a power strip. The power strip has has an ability, has a circuit breaker on it. That can come in very handy when you get a surge, and your computer will now be protected, theoretically anyway, or at least there's some protection with the surge protector in that power strip. Make sure everything is off at the same time when you're done. TV's always running? Well, yes, well, sure. If you don't turn your cable box off every time you shut off your TV and lower your TV's brightness settings, the disable instant on, always on, or quick start settings, they all draw standby power. So it's something you should do. And beware of what's called vampire voltage. Don't leave chargers plugged into the wall when they're not charging something. They will still draw energy that you're not using.
Okay. And a concern looking ahead. School and property taxes are due in September. This resident asked their town hall if they will be pushing the date back since people right now are out of work and may not have enough money. And the town that they reached out to said no, they were not considering pushing it back. What are your thoughts about
Okay,
this?
look, I myself in my lifetime, I've been in between jobs. It is a scary thing. The money you put aside sometimes can disappear very quickly. So it is a scary thing. But first of all, I want to reassure people, I fully expect that most people will be back to work well before that point in time come September. People will recover. It's tough for many. It's tougher on some. I know it's difficult. But we're doing everything humanly possible here locally to restart our economy as quickly as possible and get cash back into your home and business budget ASAP. So that's what our goal is here right now, to return to some sense of normalcy, to get rid of this fear on a bill that you're going to have to pay at some point, whether it's delayed or not. So we want to make sure that we get you back and up and running in a fiscally healthy manner also, besides being healthy from a public health perspective. That said, tax collection dates are set by New York State statute. So any change that it relates to that would have to be a state law or legislation introduced and passed in the state of New York.
And a number of people are concerned about this inflammatory disease in kids that could possibly be related to COVID-19. What are we doing about that here locally, and what more can be done to protect children?
Okay, again, what can be done to protect children is the same thing you do to protect anybody else around you. Social distance where you can. Proper hygiene. Make sure children know they should wash their hands at specific times during the day. If child is over 2 and can tolerate a mask, have the child wear a mask. These are all things that should be done. We know that early on, and to some degree even now, the segment of our population has been hit the hardest has been, as a general rule, people who are older and people who also have underlying medical conditions or autoimmune issues. That seems to be the significant piece of the cohort. Not that we have had other people get sick and pass away for sure, but so I would not underestimate this virus in any way, shape, or form. This pediatric multi-system inflammatory syndrome that's affecting children may be linked to COVID-19, and I say that for a reason, because it also could have other origins. I don't want to have people unnecessarily panicked, but I will tell you that there clearly is a strong focus from the state health department. They're devoting numerous members of the medical community to track this down. We are working with the New York State to do the same thing. We're looking very carefully at future steps that we take as it relates to children. So there's a lot of attention being paid to this up and down the line from the localities here, county and state, to address any situations that may indicate that a child is becoming sick from COVID-19. We have one to call in schools.
Yes, we had one sort of kind of late question here to jump in on. What options are available to schools and students who want to celebrate their graduation in some way this year?
Yeah, graduations, again, it's a once-in-a-lifetime situation. I've had 2 sons graduated from North High School here in Rockland County in Clarkstown. It is very special. There's no doubt about it. As a matter of fact, this issue actually came up on the phone call I was on before I came on here to do this broadcast, and the issue of graduations. I have gotten a number of phone calls from parents, from PTA. I'm a lifetime member of PTA. I still maintain my contacts with folks in that community. Some of the ideas was, could they go to Boulder Stadium? Could they go onto a field at their school? We spoke about a number of different options that might be viable, but the one that I said is most important is that the governor has an order out now that basically bans all gatherings. We softened it a bit, and we were able to, through a health commissioner's order, allow up to 10 people. Neither of those is going to accommodate, obviously, a graduation. But specifically, this question did come up, and the governor's staff made it very clear that a graduation at a ballpark, at a field, if it's a gathering, it is barred by emergency order by the governor. There can be the drive-throughs if there was something going on where the graduate and family were driving through a certain location, much like we've had. We lost obviously our county clerk Paul Piparato. We did a drive-by his home, and saw his family. We met it at North Rockland High School parking lot and drove over to Rossman Road where Paul's family does live. That's something that's legitimate. So I guess the rule of thumb here is if you could have some sort of celebration where everybody is boxed in, basically, where you're in a car, for example, but they can't get out of the car, have a public gathering. That is not going to be allowed, and in fact is barred by the governor's orders. Look, there's been a lot of conversation revolving around the expiration of emergency orders, reopening the economy. The bottom line is this: doing nothing is not an option, and in point of fact, rarely is doing nothing ever an option under any circumstance. Look, unlike measles, which we've been through, there is no vaccine. There's no natural immunity that we're aware of right now. So we move forward, and we do so with a people-first effort. We move forward carefully, which in a judicious manner. I showed this last time we were on. I'm going to show it again because I think it really says a lot. This really talks about where we are right now. And it says, believe it or not, it's okay to be all three. You could be someone who takes coronavirus seriously, which both of us, I think all of us do. You could be very concerned about the impending economic devastation, and we are taking significant hits in our economy here and fiscally. People worried about the expansion of authoritarian government policies. And then there's me right in the middle. These concerns are not mutually exclusive, and that's one thing I do want everybody to understand. But again, I said doing nothing is not an option, but we have fears here, we have angst, we have concerns. They're all real. We all understand. I certainly understand. I have two of my nephews, NYPD, both contracted COVID-19. Thankfully, they pulled through. My cousin Ed contracted COVID-19. He was on a ventilator in a hospital up in Vermont. That's an 80% chance of dying. He pulled through. Tough guy. He always was. It's just something that you just don't, you concern yourself with and you worry about. I'm a parent and I'm a grandparent, so I certainly understand these concerns. An orderly, structured, smartly, transparently, intelligently, and with due caution. Those are the things that we have a measurement on as we are working to move our economy forward. We have high expectations from the business sector. We expect firm protocols to be established and followed. They need to be implemented and designed to protect both the client or customer and their workers, their employees. Those people have to be protected too. I am pleased to report that the industry organizations who represent many of the various establishments and industries here in Rockland County have already contacted us. They've submitted plans. They're being vetted right now. These are all things that will be expected by the state, and they will be expected here locally. The protocols and regulations that will be laid out will be followed, and we will educate with an expectation of compliance. That's a very simple approach. We realize this is uncharted territory for many of our establishments. We recognize good faith efforts, and we will help and make sure that the good faith effort turns into a protocol that's being followed. However, if they are not, those of you who know me know when I'm serious, and I am serious about this. We're not going to risk the health of the people of Rockland County unnecessarily, but we're also not going to ignore the reality that doing nothing is not and never is an option. Finally, we do have a couple of websites and numbers I just want to give you real quick. Department of Health County Hotline, 845-238-1956, 238-1956. Our state DOH, Department of Health Hotline, 888-364-3065, 364-3065. The pause hotline for any things you see that you feel are violations, businesses opening up, for example, static events that are happening, not active events that you call the police for. You call the pause hotline at 833-789-0470, 833-789-0470. It's a 24/7 number, and their contacts here are the Commissioner, Deputy Commissioner of Health, the County Sheriff, and the County District Attorney. Finally, we have a couple of websites, rocklandgov.com, which is your county website. A lot of information on many things in county government, but specifically to our conversation today on the COVID-19 crisis and things that will be helpful to you to know about the virus. ny.gov, if you have a need to look at the governor's orders or look at anything else that comes out of the state, you go to ny.gov. And again, the newest website, forward.ny.gov. forward.ny.gov. This is the booklet that comes out now. It looks like this, and there's a lot of good information here about what is going to be done to reopen our economy and how they're going to do it. I think people will find it comforting to some degree, knowing that there's a lot of thought that's been given to this, and a lot of things being put into place to ensure that things are done properly with you and your family's health and safety at their utmost concern. So with that, we will be back here on Tuesday. Hopefully we'll have some better news for you next Tuesday as it relates to what's going on. But with that, I'll wish you an early good weekend to everybody, and just take care of yourself, stay healthy, and God bless.